Luciana, Egmar, thank you so much. That was fascinating. People do please put some questions in the chat function, and I've seen a couple that have come up, and Luciana has indeed responded to one of them. I mean, comment stroke question from me. I was fascinated by the extent to which it's embedded, PPI is embedded and established within Brazil. And you outlined some of the kind of central things that you're doing around education, etc. And you also mentioned about translating various documents, including the UK public involvement standards. And one of the things immediately I thought of was, have you thought about developing some standards, some values, some principles that are unique to Brazil that reflect your experiences, your culture, um, and your environment? And I say that because we're doing some work with colleagues in Singapore, and that's a part of the starting place for them is they've adapting existing resources out there. They're not reinventing the wheel, but taking what they think is good things, looking at those, taking the bits that they like and the bits that are making them appropriate for their culture and doing it that way. And there's something about, I think, having some national guidance, it provides a clarity for everybody about what it is. And you've got that language there, and people understand the concepts, what it means, and it's appropriate for that culture. So, as a kind of as a rambling question, but just to say, yeah, have you thought about doing that, developing your own national guidance?
Yes, I can start, Luciana, with it because when we thought about to translate the UK standards for PPI, I think one of the main concerns it works for our country because we thought that we are very structurally community doing PPI. So things are very in an works in a very natural way uh, as governance and working together, training. So here we are starting. So it's challenging for us to say that we are working with PPI and doing and respecting all UK PPI standards
Mm.
because we are not. We cannot do with it because we don't have a balance between
Sure.
public and research in all actions here in Brazil. We have only a small quantity of public representatives, but we think, Gary, it's a good start translating and seeing what is it in our
Mm.
language. And in the same way, we are building a training, more public of representatives, so we can discuss with them. It's not only the research perspective to change it or another piece of the documents. We need to discuss with different public representatives. So yes, I think it's an important thing for the future.
Mm. And I like that your approach is quite organic. It feels and very bottom up, and I do think that will stand you in good stead in the future, having it that way. So it's rooted in patients' experiences and patient groups, etc. And I think that's really good. But another route might be, or an additional route might be about focusing on research funders as well, because from a UK experience, obviously, once a fu research funder says, "Well, you have to have this thing," that
Exactly,
yeah,
exactly.
there is that now. And I know there might be people on this call that will say, "Well, there's strengths and weaknesses in that approach too," but it's another approach, isn't it, that one could do? Because once they start asking for it, then everyone says, "Oh, we need to do this thing. Where's the
Exactly.
training, etc. What do you mean by this?" Yeah.
Yeah,
Yes,
it's
Gary.
starting now. Yeah, it's
Yeah.
kind of starting now. As I told, there is a new law for clinical research here in Brazil, and we have a lot of social participation in the government, in the health system, and now they are understanding that they can have this into research too. So I went to a meeting, a huge meeting. It was a national meeting with the ethical committees. And the person that is coordinating, she was talking about PPI. So I was amazed. I did a lot of videos. So once they start to talk about PPI, then you know that, okay, it might take a while, but they are already starting to talk about it. And it will be for sure like in the law, and then it will be easier to get funding and everything. So
Yeah. And that funding, that's a key thing, isn't it? Because at the moment, a lot of your
yeah.
work's obviously is done on goodwill. But it's really great that I see. I like that approach actually of embedding it in the training courses. And if we could make that the norm, like across the globe, so all healthcare professionals kind of when they're doing their training to be doctors, nurses, etc., that becomes the norm to involve the patients in the research and know how to do it. And if you make it the norm, then it makes life easier, doesn't it? So I really like that approach. We have got some questions that have come up.
Okay.
I've got one here from Shumela. Now this is a difficult one actually, and it's very specific. So Shumela is doing a doctoral research. Congratulations, Shumela. I wish you luck. And she's going to co-design a nurse-led intervention to improve self-care behaviors in patients living with colorectal cancer. Different stakeholders are going to be involved in co-designing, and that includes patients, families, caregivers, nurses, and oncologists. As this is a sensitive patient group, and obviously challenges may arise, do you have any tips or suggestions about how Shumela might proceed? I told you it's a
Uh,
difficult one.
Yeah. Do you want to go ahead or can I go ahead, Egmar?
Start with your perspective from the public so I can
Okay.
add after.
Okay. Shamila, I have some experience with the oncology patients. Okay, so first thing, I think it's important if I don't know how many patients you're planning to involve, so I'll give you some tips about involving patients, okay, as one of your stakeholders. Um, you let you have to let them talk. You have to let them tell their stories when they are connecting. So your first meeting will probably be listening to them. This is really important because if not, they don't feel that they are being understood. So this is I think the main thing to start working with patients. You really have to connect with people. It's not like it's not just taking out of them. Please listen to them, let them talk, and then you will see it's amazing how they can collaborate with you. Sometimes it's difficult if they're doing the treatment and then you want to involve them. So sometimes it's easier if you get someone that has already finished the treatment or a family that is not that involved in the, in the urgent care or in the procedures or surgery. So sometimes you just get people that it's a little bit out of that. So this is another tip that I can give you, and always have an informal place for people to connect, because if you take them depending to university or a very formal place, people can be shy. The patients can be shy to to talk about it. It can be very intimidating. This is I'm telling from my own experience. Now I can come here, I can talk, but this can be very, very, very intimidating for patients. So this is my view. But happy to talk. You can reach out to me and we can talk about this another time.
Yes, and I think I can just add that I think if uh, you can start thinking about to promote a safe space for these people to bring like bonding with you. So uh, to start about or to talk about mm, challenging things, you need to build some relationships with these people so we can run these activities and in a more natural way. So I think it's a very important thing to start with in running conversations in in a very informal space, giving them opportunity to express their preference, how they would like to have this space, and in the same time we are promoting time to build bonding between you and them and theirs.
Fantastic, thank you. And Sophie asks, have you got any plans to publish your work in academic journal? There's so many journals out there. Research involvement and engagement is
Yes.
one.
We have published one of a piece of our job there. It was a co-design from my master students, and we are working on the results of the PPI school. So we run the second one. We analyze the pre and post questionnaires about the satisfaction and what they have learned with this approach. And yes, definitely we are very interested in publish this piece of our work there. Yeah.
Fantastic. Okay. We might be in contact you about that then. Um, I've got a question here from Carolina, and this is also a tricky one. So, a specific project. So, Caroline says one thing she sees is doubts among researchers in Brazil about who should be part of a PPI committee in a project. And Carolina has a project on the influences of father engagement in early years and the associations with later child mental health and gender norms attitudes during adolescence. And Carolina is currently seeking UK funding, and it'd be great to have some insights in how to implement PPI throughout her project. So I know often you need a lot more information, but if you can give some generic advice to Carolina, I'm sure she'd be very grateful.
I can start with it. I think the first thing that we have done here is to be in contact with some people that we have met in some time of our uh, career, patients or professional to create like a small PPI group. So discuss with them about the project, about the strategies to recruit or to bring more other representative from the public into the table to discuss the project and the strategies to run and to engage them in the different stages of the project. I think I would start with it, inviting people that I have met, and I I know that it's a mom that she likes to talk or to give their opinion and things, and bring them as a partner to discuss about the project and design the funding plan to apply, for example, and to international agents. Luciana, would you like to add some thoughts about it?
Yeah, I think like I totally agree with you, Egmar. Um, and if you have some difficulties in finding these people, as I said, you can go to the foundation. So if you're talking about diversity, there are a lot of organizations now talking about it. So you can reach out to these people, and they will for sure get some people to support you. But it's important to talk to them about research because probably they won't have any knowledge about research. And another thing that it was one of the things that I learned from one of the PPI schools is that sometimes if you have a population that is very vulnerable, you can reach out to it's a health um, person that work with these kind of communities, and they do understand a lot about the community. So sometimes you're not able to reach out. But these people that they work really close, they go from one house to the other house to the other house. They really know well their communities. So once you can reach out these two people, and it might help you getting the people that you need.
Fantastic. Thank you. And I'd just like to mention to Swagata here from India. And she started with a PPI group focused on critical care survivors. So it's not a question, families and community representatives. And it's early days, but it's very, I think, nice. She says she can resonate with some of the barriers and facilitators that you presented, and I did too. And I think that's one of the interesting things about public involvement, is that you do see similarities right across the globe. They might express themselves in different ways, both the challenges, the barriers, the facilitators, but I think they are there, right across countries, and we're all grappling with those things about how we can embed further. And we will be running a workshop in August. I don't know if Ricky, if you can put the date in the chat, would be really helpful. And it's a roundtable event again with colleagues from Singapore, but it's focusing and embedding patient and public involvement in Asia. And we will be like looking at challenges, facilitators, ways forward, etc. And I think that would be of interest to yourselves, and of course many of the people on this call. We're going to sort of try and move forward with that. Well, I'm going to bring things to a close there. Can I have the final slide, Ricky, if that's okay? Lovely. Thank you very much. So first of all, I'd like to thank Egmar and Luciana, which I thought was a really fascinating presentation on PPI in Brazil. And it's really great to hear your experiences and the projects you're involved in, and in particular the training, say the facilitators, the barriers, and that was marvelous. Please do, if you happen to be on Twitter, you can tweet us at Global PPI Net. And hashtag Global PPI Network. You can join the International Patient Public Involvement Network if you aren't already, and it's free of charge, of course, but you do kind of get access and forward notice, if you like, of events and invitations, etc. And there is the address there. You can also follow us on Blue Sky at ipin.bluesky.social. And of course, you can connect with us on LinkedIn. So again, thank you very much, everybody. You will be receiving a recording of this, and it will be available, of course, on our website. So thank you again, Egmar. Thank you, Luciana. Thank you, Ricky, for all the work you're doing behind the scenes and for organising it. And thank you, the audience, for giving up your time and your wonderful contributions, comments, questions, etc. Have a lovely rest of your day, everybody. Bye bye.
Bye. Thank you.